the condition to help prevent those conditions from happening in the first place. And what this executive order does is it orders us at HHS to take this extremely seriously, as we have been for the last year and a half and more of the presidency. At the NIH, what we've done is we have established the Autism Data Science Initiative, which started almost a year more, actually more than a year ago, where we funded a dozen and more major research teams to answer the question of what is the cause of autism. It's a complicated biological phenomenon. It's not going to be a simple answer. It will have, as the Secretary said, potentially genetic predisposition, but that cannot possibly explain why we've seen such a large rise in autism. There must be some other environmental factors involved, and that's the basis for thinking that's driving these dozen and more research teams that are looking at this. The science takes time. It's very frustrating, and I know I felt that frustration myself. As a scientist, you don't get answers immediately. But the teams have been working assiduously for a year. And the main thing I want to emphasize that we've already accomplished in that year is we've changed how people and the scientific community thinks about autism. You've given them permission to ask the question that would otherwise have been difficult to answer if you come to an answer that links autism to some other politically correct things, and you all of a sudden have this link, as a scientist, you fear that your career is going to be over. What we've done in this administration is we've given permission to scientists to honestly answer this question, to find the link for the first time. And with the change in the vaccine recommendations that the president has signed, what you have given is parents a choice, autonomy, a decision-making over how they want the vaccines given to their kids. I believe fundamentally that many vaccines are important. Like said, measles, for instance, the measles vaccine is important if we want to take control of the measles outbreak. But at the same time, we shouldn't be keeping kids out of school because they have made different decisions than other parents. Our European colleagues don't do that. A lot of the collapse in trust in public health has come because of these mandates that we've seen imposed during the Biden administration on the COVID vaccine and so many other things. What this does is it restores autonomy of families and parents to make good decisions for their kids. It allows and continues to emphasize the importance of science in recommendations about vaccines, and fundamentally restores a sort of a healthy relationship between public health and parents, more in line with what happens in European countries than in the United States, where the childhood outcomes are often much better than we see here. It's a big first step that and that builds on what we've been working on the last year and a half toward a more sane public health system that sees healthy kids grow up without pressure, without undue influence, to make good decisions for their families and for their kids.
Thank you, Jay. Steve, please.
Thank you, Mr. President. Because of your courage and leadership, Mr. President, millions of parents all over America today are breathing an enormous sigh of relief. I say this as the parent of young children myself. Millions and millions of parents feel they've been pressured when their children are just weeks out of the hospital to take 5 shots, 6 shots, 7 shots all at once. They're told it'll be normal. Your kid will have a fever of 103 for 3 or 4 days. Your kid will stop eating for a week. Your kid's going to change all their sleep. Don't worry, it's totally fine. It's totally normal. Nobody has studied it. Nobody's looked at it. Nobody's thought about it. The pressure from the pharmaceutical industry and from aspects of the medical industry to pump your kids full of shots days after birth with no understanding of the long-term consequences has been a medical travesty. This is an issue, Mr. President, that you have been leading on for years, and of course the man to your left has been leading on this issue for years as well, too. It's a really incredible moment to stand here today and finally see the concerns of parents around this country addressed. There's been so much heartache where parents have had healthy children with no issues. They know they've been pressured into doing things that they didn't want to do, and medical science has told them for years that their concerns are not valid. This order does 2 fundamental, incredibly important things. First is we get off of this ridiculous path of having our children get 70 to 90 shots. That is wantonly excessive. Remember, each and every one of these shots produces a profound immunological response. So across any large population, if you give a kid shot after shot after shot, you're going to have vaccine injuries. You're going to have immunological issues. You're going to have potentially neurological issues. Secondly, and so important to you, Mr. President, is the unbundling of the shot. Why do you need to have these shots bundled into these packages? Why can't you split it into 5 visits and give this young body, if a parent wants to do a vaccine, 1 shot at a time? Why is it that in Japan you can get a separate measles shot, a separate mumps shot, a separate rubella shot, but in America it has to all be packaged together? This is a courageous action, Mr. President. This is an action that ensures the dignity of patients, the dignity of parents. It restores choice. It says we're going to let the parent and the doctor make a sound medical decision. And again, I'll just say one more time, the fact that you have had the courage to push this forward, knowing the unfair criticisms from some in the establishment, and to give the chance for Bobby, who spent decades representing parents, to stand here today. It's such a profound moment, it's such a beautiful moment, and it's going to lead to such incredible advances in our understanding of children's health and making sure that, yes, we can be a country that has safety and security for our families and our children, while at the same time protecting patient choice. You can have both these things. This order accomplishes it. I'm so proud to be standing here today, Mr. President.
Thank you very much, Steve. Thank you. Heidi?
Yes, thank you, Mr. President. It's an honor to be here today. It is a historic day and a historic action. Many people have asked the difference between this executive order and what you signed in December in a presidential memorandum and what you signed later on in May. Just want to quickly answer that question. In December, the presidential memorandum directed HHS to produce the scientific assessment that they did, and then they overhauled the vaccine schedule. Those actions have since been held up in court. And so right now, Americans don't have access to that information, and you are correcting that wrong today and saying, I am giving Americans this information directly so that they know what HHS found in the scientific assessment themselves. But most importantly, states are actually the place where school vaccination requirements are implemented. It's state laws and regulations, and the CDC would advise the states on those policies. Since January of 2026, 28 states have no longer agreed with the CDC, and they recommend their own policies. A lot of those states are blue states, and they're working with outside entities like the American Academy of Pediatrics that still rely on the recommendations that were in place in 2024 with the 72 injections by age 18. So you are saying, especially to states that are willing, take a look at this scientific assessment. These are the gold standard childhood vaccine recommendations, and you should put this into your state law so that when parents go to enroll their kids in school, they do not have to meet some of the requirements for the vaccines that are no longer recommended for all children. That brings us in line with European nations. And importantly, those nations do not have vaccine mandates for school. A lot of those nations maintain vaccination rates for measles above 90%. Denmark, Ireland, Spain, Portugal all have vaccination rates for measles above 90% without mandates for school. And so they do that through increased public trust and education and letting parents be informed and make those decisions. We are encouraging to adopt those decisions here today. We do still recommend the measles.
If you like this video, then like, share and subscribe to Mirror Now. If you like this video, then like, share and subscribe to Mirror Now.